Hi guys, so for those of you that don't normally watch our channel, my name is Jillian and my husband and I make vlogs of our family to kind of document our life with our little baby Jackson. So I decided to do something a little bit different because I enjoy watching videos of other mommy YouTubers, so I thought I would join in and start making some videos of my own, mainly so I can remember things, because I find that even though my son's only 10 months old, I'm already forgetting so much, even though I document a lot of it. So today I decided that I would share with you guys my labor and delivery story. It was pretty uneventful. I didn't have anything too crazy happen. I didn't have to make any big decisions that I wasn't ready for or anything like that. So my whole pregnancy, my son's head was measuring in the 95th percentile. Some of them were greater than 95th. So that was a little concerning because I'm only about 5 feet tall. I have big hips though, so I feel like I was made for getting babies out. So I wasn't too concerned, but I was a little bit worried about it. My husband has a very big head, so it's not that surprising. But so after talking to my doctor about this, I ended up having to switch OBs about halfway through my pregnancy, a little bit more than halfway, because we moved from Houston back to the Tulsa area. So once I talked to my new OB about this, she was like, well, it's something we'll keep an eye on. So I had a growth, I forget what they call it, like an ultrasound to check on the growth pretty much. And so, see, I've already forgotten so much. I had one at, I want to say 34 weeks and at 37 weeks, I think. And so both of those, his head was still measuring greater than 95th percentile. So then the decision was made that if I didn't deliver by the Wednesday before my due date, I was due Sunday, April 6th. And yeah, that's right, Sunday, April 6th. And if I wasn't in labor on my own by that Wednesday, so April 2nd, then I would go in to be induced. And my OB was completely for this, but she wasn't against it or like pushing me to do it, if that makes any sense. She was just fine with whatever I wanted to do. At that point, I was all for induction. I think I was a typical first-time mom. I was just ready to have my baby. I was done being pregnant. I work as a nurse, and so those 12-hour shifts were really starting to kill me whenever I was like 38 weeks. It was miserable. So I was just like, I need this baby out of me. And at that point, I felt safe about it because I knew that he had grown all that he really needed to, and at that point, he was putting on weight and yada yada. Either way, at that time, I was all for it. I wanted to be induced. I was so happy that she was for me being induced. And that was the plan. So Wednesday came and I was experiencing a few little changes that I won't get into because they're too TMI, but I could tell that my body was preparing. And also, like every first time mom, like once I hit 37 weeks, I always thought I was going to be in labor soon. And just any little weird feeling, you're like, oh, this is totally going to mean the labor is coming. And of course it never does. But anyway, so I went with my husband to Qdoba to get a burrito. And it's actually kind of funny because I'm so weird about my weight. I'm always on a diet, always trying to lose weight. It's ridiculous. And so I gained close to 40 pounds during my pregnancy, mainly because I went from not eating carbs at all to that being basically the only thing that I would eat. But so anyway, I didn't want to eat very much because I was afraid they were going to weigh me once I got there to the hospital, and I didn't want it to just be astronomical. So like I was trying to eat light. I was so stupid. And then we went and got ice cream after that. We headed over to the hospital. We had to be there at 7 p.m. And we got there, went through registration, did all that jazz. Got to the floor. They started my IV, drew some blood for some lab work, and I was basically hanging out. At 9 o'clock, they started my Cervidil, which to the best of my knowledge from what I remember is kind of like a long strip-like thing, which I picture it, I mean, this isn't going to make any sense to somebody that's not a nurse, but there's a stuff called iodoform gauze that's just really long and like skinny. and use it to pack wounds. But I feel like I remember it looking like that, just kind of like a long, skinny piece of fabric. And so they stick it up against your cervix, and that's used to thin you. And because I wasn't, my last appointment, I think I was like maybe 30% effaced, and I was like not dilated. They told me a fingertip, but I think they were just saying that to make me feel better. But sorry, I had to check and make sure I was recording. I was paranoid that I wasn't. So anyway, I forgot where I left off. But at my last appointment, I believe I was like 30% effaced and a fingertip dilated, which is like not at all. And that's how I was whenever they checked me whenever I got in. So they put the Cervidil, that thins you out, makes your cervix thin. And then the next morning I was going to start Pitocin. Well, that night I did the Cervidil. It came out a few times. They had to order more and get it reinserted. And that was pretty awful. They offered me pain medication, but I didn't want it because I'm not somebody that takes medication very often, and it's really only whenever I've got really bad cramps or a migraine. Like, I have to be pretty miserable to take it, and I'm really sensitive to medication. Whenever I had my gallbladder out a couple of years ago, I remember they gave me Dilaudid, which is a strong pain medication. It's like 15 times more potent than morphine or something like that. And I ended up having to stay the night in the hospital because, and it's supposed to be an outpatient surgery, but I would just never wake up and come around from the anesthetics and the pain medication that they gave me. I just couldn't wake up. And so I didn't want to mess with that. I didn't want to feel bad. I didn't want to feel funny. I wasn't really worried about the effects that it would have on SJ because I know that it's relatively safe, but it's just not something that I wanted to do. Sorry, my neighbor's walking outside, and I'm pretty sure he can see me talking to myself. He's looking in the window right now. I've got my windows open so that I can have some light. That was really awkward. But anyway, so we did the Cervidil. It was pretty painful. It just caused a lot of vaginal cramping, I guess you could say. Like, I wasn't feeling anything up in my stomach, up in my uterus, nothing. It just felt like I was having like muscle spasms in my vaginal walls, which sounds disgusting, but hey, I'm sorry. If you're watching this, you probably want to know about it. So that's what happened. It was just really uncomfortable. I started getting pretty regular contractions that night. However, that morning I still hadn't really dilated much at all, so they really weren't doing much. And they were completely tolerable. It wasn't anything bad, but I still couldn't sleep through them. I think part of it was the pain, and I mean, it was bad, but like, it wasn't horrible, don't get me wrong, but just that the pain was there and the anticipation of having a baby. So that night I did not get any sleep. Shaler says he didn't either, but I was watching him snore on the couch, so yeah, I don't know. But anyway, that next morning, if I remember right, I'm sorry, it's like all such a blur. I really wish that I had filmed this earlier, even though I still think I would have been confused about time frames because I was just in so much pain that day. But anyway, so my OB came to see me that morning, I believe, like before she went to her office or something like that. And she kind of checked on me, was like, hey, you've thinned out quite a bit, you're still not dilated, we're going to still go ahead and start the Pitocin. And so I was like, okay, fine. Like, I did not know what I was in for at that point. So they start the Pitocin. They do the lowest dose there is, and that jump-started things immediately. Once again, I don't know the time frame, but the Pitocin was started, and then my husband, we live an hour away from the hospital, so Shaler had to go let our dogs out and just kind of spend some time with them and then come back to the hospital, which that's what I wanted him to do. I encouraged him to leave. I didn't want him to stay there with me. My dogs were my priority at that point. So he left, and by the time he got back, I was in such intense pain. I was throwing up everywhere. My contractions were coming one on top of another. They weren't completely letting up before they would start back up again, and it was just constant. I could not get any relief. I'm not kidding you when I say it was the worst pain that I have ever felt or that I can imagine feeling ever. Like, I just can't even explain the pain. And I've got a very, very high pain tolerance. I've had endometriosis since I was very young, and I have periods where sometimes, I haven't had them in forever, thank goodness, but where I would pass out from the pain. I passed out in the back of my car one time whenever I was leaving a nursing clinical to go to Walgreens to get some of those little like thermacare heat things and some ibuprofen. Like, I literally passed out in my car from the pain. Like, it's just awful. So I was thinking, since I'd had that awful period pain, that I would be okay. And I was correct in thinking that it is a very similar type of pain to what I had been feeling, but it's on a much crazier, intense level. So anyway, that started, and I previously had thoughts where I was like, well, maybe I'll do this without an epidural. That'd be really awesome. Mainly so I could throw it in my husband's face, like, hey, I delivered a baby without any pain medication. But I didn't really, sorry, I keep going off into tangents, but I didn't really have a birth plan. I'm one of those people, I work in the medical field, I know things go wrong all the time. I know unexpected things pop up all the time, and especially in labor and delivery, if you've got some written out plan, it's basically 100% that it's not going to get followed that way. My goal was to have a healthy baby, and hopefully I would come out of it healthy too. I mean, if I had to choose, I obviously would have chosen that he was 100% healthy and something would have happened to me. But regardless, my main goal was for both of us to be healthy. So I wasn't really too concerned about, I wanted it this way, I wanted it that way. Of course, I didn't prefer to have a C-section, but if that was what it took, then that's what it took, and I would have been okay with that. But, so I would have loved to go without pain, or the epidural, but that was not possible. Like I said, I was in such pain, I was throwing up, I couldn't breathe, I couldn't do anything. And my husband came back from me being in a little bit of pain, but relatively okay, to that. And I remember looking at the look on his face. He'd never looked so helpless before. He didn't know what to do. And I was so proud of myself. Everybody thought that I was going to snap and be completely awful to him, but I wasn't. I was in too much pain to even be mean. I just couldn't even respond to anything. And so the nurse was like trying to put me on the ball and in this position and that position, and nothing worked whatsoever. Like, nothing even took 1% of the pain away. So during my whole pregnancy, as a nurse, being in the healthcare field, I see a lot of student nurses, student doctors, student everything. So, and while I know that somebody has to learn, I had to learn somewhere, I don't want you learning on me. But once again, in that time, I was in so much pain, I didn't care. So whenever the nurse anesthetist student or anesthesia student, I don't know if it was a med student, CRNA, I don't know, but it was a student, came in with the anesthesiologist, I was so angry, but I didn't care. I just wanted somebody to stick a needle in my back and fix it. So they kept telling me, oh, your anesthesiologist is amazing, he'll have it in 5 minutes, it'll be perfect, he's on his way over here. And then of course the student thing popped up. So they get all donned up in their sterile equipment, sterile PPE, and I just hear the anesthesiologist yelling at her about breaking a sterile field, and I was just like, are you serious right now? Like, for one, why are you calling her out where the patient can hear you? And for another, I know exactly what you're talking about, so this is making me extremely uncomfortable. So she's sticking the needle in and doing stuff. Sorry. And I knew that it wasn't going to be comfortable. I mean, somebody's putting something into your back, like, that's not natural. But I knew it wasn't right. I kept having shooting pains that were only going down my right side, and they were like in my hip going all the way down to my toes, and it was just like, it felt like somebody was like taking an ice pick to me. And so I kept telling them, like, this isn't right, I'm feeling shooting pains on each side. And so then the anesthesiologist basically told her, no, you're not doing it right, and kind of, after going back and forth and them trying multiple things and me sitting there having pain 10 out of 10, I just can't, I don't know, just thinking about it, like, I just can't even believe that I went through that and made it out. But anyway, the anesthesiologist steps in and sorry, excuse me, and gets the epidural in. The student gives me the medication. They gave me a bolus, which, by the way, I only used that bolus the entire delivery, labor and delivery. I never used the pump to kind of give me the extra boost. That was plenty. But anyway, so I don't know if an incorrect amount of medication was given. I don't know if I just couldn't handle the amount of medication that was given or what it was. But regardless, I remember after they all left, I had my nurses in. They were going to come put in the Foley catheter and do whatever else. And I remember thinking, wow, that epidural is really making me feel dizzy. Like, it just hit me all of a sudden, and I felt kind of funny. And then it kind of increased. And I didn't really know if it was normal or not, because like I said, I'm very sensitive to pain medication. So I thought, well, maybe I'm just sensitive to this, and that's what it is. Well, they laid me back because they were putting the Foley in, so I was completely flat. And they had a Dynamap, a blood pressure, and like a vital machine, right where I could see it whenever I was looking up. And I saw my blood pressure was like, it was in the 70s over 40s, which is insanely low. And my heart rate was down in the 40s, which before that I'd seen it. I was running like 90s, slightly tachycardic because I was really anxious. So I was like low 100s in the 90s. And obviously, as a nurse, I'm like, what the heck? Like, this is 100% not normal. Plus, I was symptomatic. I was feeling really dizzy. And I told them, I was like, I think I'm going to pass out. I'm really dizzy. And, yeah. So then that's whenever, like I said, my vital signs pop up. And they're all freaking out. I'm guessing that because my blood pressure was so low and my heart rate was so low, Jackson was affected. So then they all started freaking out, repositioning me, throwing an oxygen mask on my face, talking about ambu bags, talking about emergency C-sections, blah, blah, blah. So then what happened? Oh, I remember thinking, so at our hospital we have, because I delivered at my hospital that I work at, we have what's called a rapid response, which is what you call whenever things are kind of getting into a bad situation, you feel like something bad's about to happen. Rapid response nurses, which are basically like ICU nurses, come in and they assess the situation, blah, blah, blah. So I remember thinking, like, what if they have to call a code blue or a rapid and my friend's here? I was like, I wonder if they'll know that it's me because they know that I'm here today delivering the baby. Like, these were like the things that I was thinking. Like, I was completely calm through it all. It was really strange. But, yeah, that's what I was thinking about. So they bolus me with some fluids. They get my blood pressure up. And then another doctor comes in. I don't know who it was. Like, you just don't ask questions at this point, and you're just in another world. I can't even explain it. So he came in and basically told me, hey, you were given too much medication, dropped your blood pressure, dropped your heart rate. It's fine now. If you start feeling funny, let us know, but things should be good now. So they were. After that, it was completely normal. My pain was 100% relieved. I couldn't even feel anything. Didn't know I was having contractions, nothing like that. So my mom and my sister got there from Oklahoma City, and I have no clue what time. And I just remember just sitting there visiting with them, and I was really tired, but I think adrenaline was still going at that point, so I was fine. And then at some point, I'm guessing based on delivery times and stuff, is like 2:30, 3-ish. The nurse came in and checked me, and she was like, oh, okay, you're a 9, like, we're about ready. And so me being stubborn, I didn't want to be one of those people that was like, oh, I need to push, and they were pushing for like 2 hours. So I waited until the last minute to tell them that I had to push whenever my body was like involuntarily pushing. And they were like, oh, well, about that, your doctor's at the hospital down the street delivering a baby, so she's not going to be here for a little bit. You've got to hold it. And I was like, oh no, you don't understand. Like, this baby's coming. I cannot keep from pushing. And that was the worst. That was, since I'd had the epidural, that was the worst part. It was worse than pushing, was keeping from pushing. So, when Sheila's home. Sorry, Taylor got home and I wanted to go see him. So, once again, I don't remember where I left off, but I'm pretty sure I was to the point where I needed to push. So my doctor finally got there. They got everything ready. I actually held him in. I was surprised. So I went to push, and I believe this is one of the things I forgot, but I think I got him out in 4 pushes. The 4th and a half. So on the 4th, I was pushing, and then my contractions stopped, but he was like almost out, and Taylor said he like watched him go back in, which is kind of disgusting. But so then at that point his heart rate started decelerating, and they were telling me, they're like, you got to get him out on this next one, you don't have another push, like he's got to come out now. And so I sounded like a cave woman, Taylor said. I just let out like the loudest like grunt, and I don't know where the energy came from, because the whole time I was pushing, I was just telling Taylor, like, I think I'm going to pass out. I think I'm going to pass out. Like, I felt so weak. And it wasn't a weak, like, oh, I haven't eaten, or, oh, I'm so tired. Like, it just, I can't explain it. It's like there was just no energy left in my body at that point. And I felt lightheaded. I felt awful. So I got him out on that last kind of extra push, because I channeled everything within my body, and like all I could focus on was just pushing him out of there. So he came out. I forgot to mention, it was just Shayla in the delivery room with me. My mom and my sister were out in the waiting room. It was just really important for me to have that experience with just Shayla, and to us welcome our son into the world just together, and us to become a family alone. It was just something that was really important to me, and luckily everybody supported me in that, and they were fine with it, which was good. So, but before I went to like start pushing, whenever the doctor came in, the nurse asked me, she was like, hey, we have a nursing student out here who would really love to be able to see you give birth, and is that okay? And they were totally expecting me to say yes, because I was so easygoing about everything, but I was like, no, I'm sorry. And I felt like the biggest jerk, because I remember being a nursing student, and especially in the OB area, like you just really hoped, like you were there all day doing like pretty much nothing, just because it's not hands-on in your OB clinicals. So you're just waiting for somebody to give birth so that you can watch it. And I remember the first time I saw it, I was just like, wow, this is completely incredible. Like, I was tearing up, and I didn't even know the woman. But I couldn't. Like I said, it was really important for me for it to just be us getting to become a family together. And also, I can just imagine what my mom would have done if she found out some rando nursing student was in there watching her grandson being born while she was outside. That would have been all she wrote. But anyway, so I felt like a jerk, and I'm sure I probably hurt their feelings. But, I mean, at the end of the day, I had to do what was right for my family, and that included no nursing student gawking at me while I was giving birth. But yeah, I mean, that's pretty much about it. He was born April 3rd at 4:09 p.m. and he was 7 pounds 9 ounces. Head still in the 95th percentile. It still is to this day at 10 months. And yeah, it was just an amazing experience, and it's something that just seems like a blur. It doesn't seem like something I went through, and it's 100% true when they say you forget all the pain. I mean, already, I remember how much I hated being pregnant. I just hated it so much. I complained about it all the time. I told Shayla that I was never going to do it again. Like, this was the only time I was ever going to be pregnant. And even at my 6-week appointment postpartum, I was just so jealous of all of the pregnant women in the office, because I missed it so much, and now I missed it even more. I think at that point, whenever I was pregnant, I wasn't a mom yet. I think some people, it just clicks for them automatically, and they just automatically feel like a mom. They've got those instincts, and they feel that connection with their baby. But for me, that wasn't there at that point. I mean, obviously I loved him, and I wanted him to be healthy, and I cared about his well-being, but I wasn't a mom yet. So I couldn't appreciate anything and everything that I was feeling while I was pregnant. But it's something that I 100% would do again. I can't wait to get pregnant again. Well, I can, but you know. And I don't know, it's just crazy how things change and you once you're a mom. And some things that I will do differently, which I think I might make a separate video about this, but I would not be induced again, and unless there was a medical emergency, because still, like, even after going through this and some of my thoughts have changed on things, still my end goal is a healthy baby and doing whatever it takes to get there. But ideally, I probably wouldn't be induced again, just because my body could not handle the Pitocin. I could not do the Pitocin and not have an epidural. My body was too sensitive to it. It made my contractions 100% unbearable. Like, I'm not kidding. Like, I know everybody thinks, oh, labor hurts. Like, this was unimaginable pain. I 100% could not have done it without an epidural. So, for that reason, I don't think that I would be induced again. I do not want an epidural next time. Once again, I'm realistic because I remember the pain that I felt, and I know that I could not have done it without an epidural. But something in me tells me that it would be possible for me to do it without an epidural if the Pitocin wasn't there. However, if I was wrong, I would get an epidural again. I do have a lot of back problems from it, but, I mean, you gotta do what you gotta do. So, yeah, that's really about it. I think I rambled a lot. I'm afraid to see how long this video is gonna be, but if you have any questions, just ask me. Bye!